Good morning, welcome to Glazier's Hall and welcome to the custom-made knee meeting. Our group is London Sports Orthopaedics. We're a practice of sports physicians and orthopaedic surgeons. I'm managing partner of the practice and I'm a knee surgeon, and we're very lucky that we're based at London Bridge Hospital. London Bridge Hospital is literally the best hospital in the whole of the UK. Sounds like a bold statement, but actually it's scientifically proven. Last year, the Bupa patients voted London Bridge as the best hospital, so we're very lucky to work there.
Osteoarthritis is the most common cause of loss of mobility in adults, and it's responsible for 1 million GP appointments each year. 60% of the patients between the ages of 35 and 60 will have had some form of significant knee pain in the last 5 years. And if you look at the over 60s, and those numbers go up even higher. Osteoarthritis represents a considerable cost to the British economy. There are over £1 billion of direct costs for total knee replacements in the UK each year, and there are £5.5 billion of hidden indirect costs, which are things such as loss of economic production, disability living allowance, people taking time off work. So it's a significant problem that we're dealing with here. We've been performing knee replacements since the 1970s, and it's the second most common surgical intervention in the country. And in terms of impact to quality of life, knee replacement and hip replacement is considered the most effective of all the surgical treatments that we have. In 2013, there were just over 90,000 knee replacements in the UK, and that's gone up to 105,000 in 2014. And the number is rising, and it's going up. It's rising year on year. There is a real population demographic boom coming our way, and the degenerative diseases are going to go up. The number of knee replacements we're going to do are going up. We really need to focus on patient satisfaction, and that's something that has changed in the surgical community. That's what we're focusing on more and more.
Latest stats are approximately 1.2 million total knee replacements performed worldwide every year, and that figure is going to go up. 50% of early implant failure is due to either poor alignment, instability of that knee, or a failure of fixation. So we've got to also bear that in mind in terms of how we can do a better knee replacement.
We would like patients to get back to where they want to be. There's no doubt about that. It's all about just giving them their options and giving them the realistic answers in terms of what they can achieve. Obviously, the significantly high demand stuff, then we might not be able to achieve that. But mindset does play a big part.
What we've found is that there's no difference whether knee replacements are navigated, so there seems to be something inherently wrong with standard total knee replacements, such that even when they're put in perfectly, they still don't give very predictable results. We've touched on this before, but basically the problem with current methodology is the one-size-fits-all philosophy. I tell patients a shoe analogy. So you go to a shoe shop, you've got to buy a pair of shoes that you need to wear for the rest of your life, and there's only 5 or 6 sizes on the shelf. And the chance that it will fit you might have that Cinderella shoe, but actually only about 30% of people truly match one of the standard knee replacements. And the likelihood is it will be too tight or too loose, or you get blisters, etc. 40% of men have some sort of imbalance or mismatch with their knee replacements. 68% of women have a similar sort of mismatch, and that leads to problems. So multi-centre trials now are finding that up to 15% of people have ongoing pain, sometimes severe. And Kneevolution, which, sorry about the pun, is the CT planned 3D printed patient-matched implant system, and they do fit much better. They're also functionally better. 99% patient satisfaction with a partial knee replacement, pretty amazing, compared to what you heard, 80%. And 89% saying that their knee feels normal after 2 years, which again compares massively favourably to standard knee replacements. The mean operative time is actually faster than a standard knee replacement, and what we found is when we were new to the technology, you were double checking, triple checking, because you don't really trust it so much, but the jigs are really good. I mean, they fit perfectly, and they really do, and actually you just have to trust the system, and the cuts are perfect each time. There's a trend towards a shorter operative time, and most cases are now done in about 50 minutes. Transfusion rates have dropped significantly, so in the past we were transfusing up to 1 in 3 patients, and that was mostly prior to the enhanced recovery program. But we found these patients really don't bleed very much, and you lose probably about 200 mils max. We've looked at blood tests pre and post, and partly because we're much more muscle sparing and the soft tissues are preserved, we're not doing unnecessary drilling or cutting of bone, and it's a bone-conserving operation. So these are some pictures of some of the joints we've done. They all look slightly different. You have to get used to looking at the x-rays because they're not quite like a standard knee replacement. So our initial impression is that the recovery is faster, patient satisfaction is improving compared with standard knee replacements, appears to be a lot less painful, and what patients were doing at 3 months with standard knee replacements, these patients are doing easily by 6 weeks.
First thing I'm going to tell you about is something really exciting, Vivostat. What we do is we take 120 ml of the patient's blood in the anaesthetic room, spin it down, and we end up with the fibrin, which is the sticky part of the blood clot, mixed in with the platelets, and the platelets are stuffed full of growth factors. So what we've got is an autologous, so it's come from the patient themselves, not from a donor, an autologous, biological, bioabsorbable, like a blood clot, it'll eventually absorb, but it's got platelets in it, so it's bioactive glue. So, autologous, biological, bioactive, bioabsorbable glue. I'm seeing less bleeding, less swelling, less pain, and it's improved early rehab. So next, Game Ready. Game Ready is excellent. Anybody can have it. How often have you heard, you've hurt your knee or hurt anything, and you say, well, ice it. And what do you say? Well, frozen peas. That is the default. You know, you can buy ice packs. Well, that's better than frozen peas. You can have a cryocuff. Yeah, cryocuff is better than an ice pack. With the Game Ready, what it does is you strap it on and it applies cooling and intermittent pneumatic compression. So it compresses the joint as well as cooling it. So it reduces pain, reduces swelling, reduces your requirement for painkillers. And again, less pain, less swelling, better range of motion, speeds up the early rehab. Putting them all together, every single little thing that can make an improvement, if you kind of constantly looking for them to try and make things better, every single little baby step gives you a leap forwards overall in terms of outcome. So multiple synergistic improvements. Constantly asking yourself, how can I make this better? Custom-made knees, do you just use an x-ray? No, we use a CT scan. We get 3D imaging from a CT, 3D software, CAD-CAM, design, manufacture, a prosthesis that fits that patient perfectly with minimal bone resection. Prosthesis fits the shape, size, contours of that patient's knee. They're made on 3D printers. I've been to Boston, seen the Conformis HQ. The technology is phenomenal.
I'm Mary. This is my new knee. I was waking up in the middle of the night. Every time I turned over, severe acute knee pain. Every morning, even by the time I got to the bottom of the stairs, 3 flights of stairs, my knees were screaming. I just lived with it for a while, and my life just became kind of just more and more restricted. I knew that I had to get a knee replacement. I did lots and lots of research online, thank goodness for the web, and that's where I stumbled across Conformis. I think at the time there's probably only about maybe 5 surgeons in the country that were doing Conformis knees, and I researched every single one of them. After lots of research, I decided on Mr. McDermott. He seemed to be top of his field. He also, of course, was the very first person to fit a Conformis knee, so I assumed he'd had quite a lot of experience. I went into London Bridge Hospital on the 4th of November 2014 and spent 4 nights there post-surgery. I didn't feel like it at the time. Having a knee replacement was the best birthday present I could ever have wished for. I'm now 12 months on, and my birthday present this year was actually cycling a 20-kilometre cycle ride around the Chianti countryside. So Conformis has worked for me. And I believe that's because I have had a seriously talented surgeon. I had outstanding pre- and post-operative care at London Bridge Hospital and through London Sports Orthopaedics. I've obviously got an award-winning knee replacement in my knee, and there's got to be something in that from all you've heard today. And I have got my life back, and I'm feeling really, really good. And I can honestly say that there isn't a day that goes by that I'm not grateful to whoever it was who's designed that Conformis knee. What I hope is if any of your patients ever decide to have a Conformis knee, or if you recommend a Conformis knee, it works for them and they're as happy as I am with the outcome. Thank you.
Thank you so much for coming, and we hope you found it useful.